Are you over 60 and noticing unusual lumps or persistent throat discomfort that just won't go away? What if those subtle changes are not just part of normal aging, but early warning signs of thyroid cancer quietly developing inside you? Every year, thousands of seniors face this hidden danger. Early thyroid cancer symptoms are often mistaken for harmless neck, soreness, hoarseness, or swallowing difficulties, delaying diagnosis and lowering treatment success. In this video, Golden Aging Health reveals 3 critical signs of thyroid cancer that everyone over 60 needs to watch for. These signs may seem minor or easy to overlook, but recognizing them early could save your life or the life of someone you love. If you or a loved one has been ignoring persistent neck lumps, voice changes, or swallowing problems, this video might be your wake-up call. Before we begin, please tap like and subscribe to Golden Aging Health. Every week, we share trusted doctor-backed health tips tailored to seniors to keep you informed, healthy, and empowered after 60. Let's start with the first warning sign that many seniors often overlook or mistake for a harmless neck issue. Warning sign number 1. A new lump or swelling in the neck that won't go away. Have you recently noticed a small lump or swelling near the front of your neck that just won't seem to disappear? Maybe it feels firm or slightly tender when you touch it, and over weeks or months, it seems to be growing slowly. If you're over 60, this could be a serious warning sign you shouldn't ignore. Many seniors brush off neck lumps as harmless swollen glands from a cold or just a normal part of aging. But a persistent lump or swelling in the neck, especially near the thyroid gland located just below Adam's apple, can be an early indication of thyroid cancer. According to the American Cancer Society, a painless lump in the front of the neck is one of the most common early signs of thyroid cancer. These lumps may feel like a small pea or grow larger over time, but what makes them concerning is their persistence. Lumps that last more than a few weeks, grow in size, or are accompanied by other symptoms should never be ignored. What's tricky is that early-stage thyroid cancer lumps usually don't cause pain or discomfort. This silent nature is why many people delay seeing a doctor, thinking it's nothing serious. However, as the tumor grows, it may begin to cause pressure on nearby structures in the neck, leading to symptoms like difficulty swallowing, voice changes, or even breathing problems. Take Margaret's story as an example. Margaret, 70, first noticed a tiny lump in her neck but thought it was just swollen from a cold or allergy. Over months, the lump didn't go away. It slowly grew larger. When she finally mentioned it to her doctor, she was referred for an ultrasound and biopsy. The tests revealed early-stage thyroid cancer. Because it was caught early, Margaret started treatment promptly and has a very positive outlook. Noticing a lump or swelling in your neck? It's a good idea to keep an eye on it. Pay attention to its size, if it changes, or if you start feeling other things like pain, trouble swallowing, or changes in your voice. Don't wait to talk to your doctor. They might suggest an ultrasound or a simple needle test to see if the lump is harmless or something that needs treatment. Early diagnosis is vital. When detected at an early stage, thyroid cancer is one of the most treatable cancers, with high survival rates. Ignoring or delaying evaluation can allow the tumor to grow and spread, complicating treatment and reducing chances of recovery. Remember, not every lump means cancer, but any new or persistent neck swelling after age 60 deserves prompt attention. Your body is sending signals. Listen carefully. If you've noticed a persistent lump or swelling in your neck that won't go away, write "lump" in the comments below. Sharing your story could help others recognize the signs and seek help early. Now that we understand the importance of recognizing persistent lumps, let's move on to another subtle yet crucial warning sign: changes in your voice that doctors are begging seniors not to overlook. Warning sign number 2: persistent hoarseness or voice changes. Could your voice changes be more than just a passing cold or simple aging? For seniors over 60, persistent changes in the voice can be more than just a nuisance or a sign of normal aging. It can be a crucial warning sign of thyroid cancer that doctors are begging seniors not to ignore. The thyroid gland sits very close to a nerve called the recurrent laryngeal nerve, which controls the vocal cords. When a tumor develops in the thyroid gland, it can press on or damage this nerve. This pressure can cause weakness or paralysis of the vocal cords, leading to hoarseness or changes in your voice. Unlike the common voice changes that come and go with colds, allergies, or overuse, hoarseness caused by thyroid cancer tends to persist and gradually worsen. You might notice your voice sounding breathy, weak, or strained. Some people also experience a change in pitch or difficulty projecting their voice. If these symptoms linger longer than 3 weeks without improvement, it's time to take them seriously. Research published in the Journal of Clinical Oncology shows that voice changes are often an early symptom in thyroid cancer patients, yet they are frequently mistaken for harmless causes, leading to delayed diagnosis. This is why doctors urge seniors to seek medical attention promptly when these symptoms appear. Let's look at Robert's story. Robert, a 68-year-old retired engineer, began to notice his voice was hoarser than usual. He initially thought it was due to seasonal allergies or overusing his voice during meetings. However, after a month, his hoarseness persisted, and he even started coughing when swallowing. Concerned, Robert saw his doctor, who ordered imaging tests. The results confirmed a tumor on his thyroid pressing on his vocal nerve. Because the cancer was found early, Robert started treatment quickly and is now on the road to recovery. If you experience persistent hoarseness or voice changes, especially if accompanied by other symptoms like a lump in your neck or difficulty swallowing, don't wait. Let your healthcare provider know right away. They may perform a laryngoscopy or imaging studies to check for tumors or other abnormalities. Ignoring ongoing voice changes or hoping they will resolve on their own could allow thyroid cancer to progress and affect your ability to speak and swallow. Finally, we'll talk about another key warning sign. Seniors should never overlook difficulty swallowing or feeling like food is stuck in your throat. This can also be a critical clue pointing toward thyroid cancer. Warning sign number 3: difficulty swallowing, or a sensation of something stuck in the throat. Struggling to swallow food or feeling like something is constantly stuck in your throat. Being over 60 means that a persistent sensation like this should never be ignored. It could be an important warning sign of thyroid cancer that needs your prompt attention. Many people dismiss swallowing problems as simple acid reflux, dry throat, or normal aging. However, if these symptoms are ongoing or worsening, they could indicate that a thyroid tumor is. If this video gave you new insights or helped you understand how to support stroke recovery better, don't keep it to yourself. Tap like, subscribe for more trusted senior health tips, and share it with someone you care about. One simple change today could mean a stronger, healthier tomorrow. Growing and interfering with your swallowing function. According to studies published in medical journals, persistent dysphagia is a common symptom in thyroid cancer patients, but unfortunately, it's often overlooked or attributed to less serious causes. This delay in recognizing the problem can allow the cancer to progress and spread to nearby tissues, complicating treatment and reducing survival chances. Linda, a 75-year-old retiree from Arizona, experienced mild swallowing discomfort for several months, but thought it was acid reflux or a minor throat infection. Over time, she began feeling pain when swallowing and had frequent coughing fits after meals. Alarmed by these changes, Linda consulted her doctor, who performed an endoscopy and ultrasound. The diagnosis was thyroid cancer, thankfully caught at an operable stage. Early intervention gave Linda a strong chance of recovery. Having trouble swallowing? feeling pain when eating, or a constant sensation like food is stuck in your throat. It's important not to ignore these signs. Try to notice when they happen and if they get worse over time. Your doctor might suggest some simple tests, like an ultrasound or a swallowing study, to check how your throat and thyroid are doing. Ignoring swallowing difficulties risks allowing the tumor to grow larger and possibly invade nearby structures such as the trachea or nerves, which can cause breathing problems and other complications. Experiencing persistent difficulty swallowing or a constant feeling of something stuck in your throat, share your story in the comments below. Your experience could help someone else recognize the warning and get timely care. Take a moment now to review the 3 crucial warning signs seniors should never ignore for early detection of thyroid cancer: a new lump or swelling in the neck that won't go away, persistent hoarseness or voice changes lasting over 3 weeks, and difficulty swallowing or a sensation of something stuck in the throat. These symptoms may seem minor or easy to dismiss, but they can signal serious underlying issues that, if caught early, greatly improve treatment success and survival rates. After 60, paying close attention to these subtle signs is vital for protecting your health and independence. Studies from leading oncology and endocrinology experts confirm that recognizing and acting on these warning signs early can make a life-saving difference. Simple awareness and timely medical consultation empower seniors to catch thyroid cancer in its early stages, when treatment options are most effective. The best part? You don't need complex tests or obvious symptoms to start paying attention. Just listening to your body and seeking help when something feels off can transform outcomes over time. If this video gave you valuable insights on thyroid cancer warning signs, please tap the like button and subscribe to Golden Aging Health for more expert, science-backed advice designed especially for seniors. And share this video with someone you care about. It could help them catch thyroid cancer before it's too late. To explore more about cancer prevention and senior health, check out our playlist Cancer and Aging Bodies, where we dive deeper into tips and strategies for healthy aging. Your journey to better health starts with knowledge starting today. Thank you for spending this time with me. I'll see you in the next video.